Duke University School of Nursing and Duke University Health System hosted the 2017 Harriet Cook Carter Lecture on Monday, February 13th. The keynote speaker was Janet Williams, Professor of Nursing and Chair of the Behavioral and Social Science IRB for the University of Iowa. Williams, whose research focuses on behavioral and family genomic health topics, presented Precision Health. What does this have to do with my practice? We spoke with Dr. Williams about her research.
Nurses have always been in a position to understand risk factors that include genomic and family history data, risks that would lead people to be at increased risk for disease or to have difficulty with the symptoms that they experience when they're ill. Nurses have always been in a position to provide education and to be sure that we can help people understand the role that genetics plays in their health. And we also are in an excellent position to know when people need information that we can't provide. And that would be the time when a person would make a referral. What's coming at us now in the future is that we will have so much more information to deal with, especially, let's take the example of pain medication. We know that some people have a very good response to a pain med, other people not so much. Part of that probably is biologically directed, not entirely. But as we learn more and more about the biologic factors that influence pain response, we will be responsible for knowing which medication matches the variants in that individual and also monitoring are there adverse outcomes when the medication really isn't the best choice. And then the challenge, not only for ourselves to understand and implement it, is to help the patient understand, especially if their medication isn't the same as maybe their neighbor's medication was or someone else who had a similar problem. I think another thing that is changing is probably, it has to do with access. That's always been a problem and a challenge. Some people who live near major medical centers have very rapid internet capability and are good at using the internet, can avail of themselves of a lot of information that help them maintain their health. As we learn more and more about the genomic aspects, that again is going to be, for some people, a greater challenge, especially, let's say, elders, people who live in rural communities where they don't have internet access or they're not very confident in using it. It is the nurse in the room, in the clinic, who is going to need to put all of that information together in a way that is useful for each of their patients. So there are some excellent opportunities for nurses to learn about genetics or genomics and to continue that learning. If at all possible, I recommend that everybody attend the International Society of Nurses in Genetics meetings. This is an organization that I actually co-founded with several other nurses who were working in genetic clinics at that time. And we realized we needed a network. We needed to be able to support each other, have an opportunity for continuing education and ways to grow our profession. The meeting this year, it meets once a year. This year it's in Reston, Virginia on the East Coast. Some students might have funds available to attend, and students are very welcome at these meetings. It's where you meet other nurses who are using genetics full-time. There are also, through ISON internet webinars, which anyone can take, and they are intended to be useful for the practitioner as well as the student. The other place that nursing students might learn about genetics is through their own nursing organization. If a nurse is interested in oncology, for example, oncology nurses use genetics in a number of ways in their practice. And there may be a state organization or a regional organization that would have current information that would be useful to student nurses. So I actually have two thoughts about ethics and leadership. And one is an answer that every nurse would already know, and that is that the American Nurses Association has just revised their Code of Ethics. And it's an excellent guide. It covers a wide range of situations, not only the interactions with patients, but how we conduct ourselves as a professional, how we understand our boundaries, and how we advocate for the public. So if an individual is not familiar with the Code of Ethics, it's well worth the time to review it. The second part of my answer has to do with reflecting on my own career and finding myself in leadership positions, and now also as an IRB chair. When I became an IRB chair, I attended a meeting where the speaker said, I learned 3 things when I became an IRB chair. And it's a bit like what my mother told me when I went to kindergarten. Be nice, be fair, and don't hurt anybody. And I thought about my role as a leader and the leaders that I admire. And I think those are excellent guides. Be nice means be respectful. Other people will not have the same viewpoint you will. You may not like the way they express their viewpoint, but there's something in there worth listening to, and you need to pay attention. Be fair has to do with justice. Everyone should have the same opportunity to benefit from whatever you are responsible for. And then don't hurt anybody is pretty much the same as, first of all, do no harm. Think about the actions that you're going to implement. If there are some risks that are in those actions, think about how you're going to protect people as best you can.
To learn more about Dr. Williams, visit our news page at nursing.duke.edu/news.